Hi, I'm Dr. Albert Kim with Signature Chiropractic here in Peoria, Arizona. And if you guys are watching this, many of you are my patients and were referred to my YouTube site because you are ready to start the spinal correction part of your care. And not only am I excited, but you should be excited because you are ready to start this process. So it's really important to understand that if you guys remember, there's two parts to the spinal correction process. One's equally important as the other. One part has to do with the adjustments and their overall function and how you move and feel for your overall spine and nervous system. The other part is going to be the spinal alignment, and again, your structure dictates your overall function. And so again, we want to not only start the spinal correction process with you, and we're going to talk about this in actually 3 parts. And the first part, we're going to talk about some basic ergonomics that we can be doing to maximize your healing potential, not only here in the office, but more importantly, all the hours that are outside this office that I have actually no control over. So if we were to break up our 24-hour day into 3 8-hour segments, this segment is going to be talking about this first 8-hour segment, which is about sleeping postures. So on average, most of us are getting about 8 hours of sleep, and then there's the 8 hours of work, and then the 8 hours of whatever is going on in between. Today's segment is going to be on our sleeping postures and how important it is and how that reflects into your spinal health and hygiene as well. So if we were to go ahead and look over here, there's 3 main sleeping postures that most of us get into. And we're going to start from the worst, which is where this guy is, to the actual best posture. And if you notice, this person is actually on his stomach, which is the absolute worst position, only because of a couple of things. Number one, when you're sleeping on your stomach in your bed does not have something that my table has, which is very obvious, is a hole for you to actually breathe. And in order for you to breathe while you are on your stomach, your neck has to do something very specific, which is it needs to turn the head and extend that neck to breathe. And you can see there's not much room for those nerves to exit to begin with in the neck. The holes are actually the smallest. And you can imagine what that does to not only the spine, but to the spinal cord and these nerves as they exit. And some of you guys are actually waking up with some numbness and tingling, causing some headaches, having heaviness in your arms, and you can see why that is. And some of you are actually doing what we call a hybrid of that, is where you guys are half on your stomach, half on your side, and it looks something like where your head is here, but your body is twisting this way, or your head is actually on its side, but your body is doing this, just like this here. And you can see the amount of torque that it causes in your lower back. For some of you that are suffering with lower back issues, some of you guys aren't improving at the rate or the process that you guys want to either. It's only because you have 8 hours of this that's going on that produces abnormal strain and stresses to the lower back. One of the better positions for you to sleep in is going to be where your spine, and you're sleeping on your side. As you can see here, the spine is in neutral. It's keeping your head in neutral. It doesn't really matter what pillow you're using, as long as your head is in neutral, like you see this person here. Some of us are using 2-3 pillows, and what that does, it actually bends the neck to the side as they sleep here, as you can see. As that happens, you're kinking the neck. Imagine what you're doing to your finger if you were to bend that finger and you're laying like this for 6, 8 hours, how many hours you guys are getting throughout the night, and then trying to let go, and what kind of stress and strain that would do to that. The other thing that causes a lot of stress as well is where you're not using any pillows and the reverse happens. Your neck kinks and it goes that way, again causing this abnormal stress to the right side of your neck, straining the muscles, waking up with tension, and that's one of the most common things we hear. And so we want to make sure that you guys are doing things on the home front to maximize, again, the healing potential here in the office and doing that. If you are sleeping on your side, I always recommend that you use a pillow between the legs. And the only reason for that is to prevent your spine to rotate, to go halfway on your side, halfway on your stomach, and that pillow typically will keep that spine in neutral just like this. The absolute best position is on your back, just like you see him, to maintain these normal curvatures to the spine, and again a pillow that keeps your head in neutral just like you see here. If you're using 2, 3, some of you guys are using actually 4 pillows, imagine what it's doing to the neck, and what that does is it strains the neck upward, and you can see how it stretches that neck, losing the curvature to that spine, which is what we're actually trying to correct. If you remember from looking at the spine from the side, you should have a normal curvature that looks like this. And for many of you that are starting the spinal correction process, we're here because your neck is either straight, and some of you are even actually worse, which is actually reversing. And if you remember what that does to not only the spine itself, but to the spinal cord, it really stretches it, causes a lot of tension, reducing the communication from the brain to the rest of the body, not allowing you to heal and to heal correctly. So this segment, as you can see, we covered mainly about the sleeping postures and how important that is to affect your overall healing process. We want you guys to all do awesome and to do well. And so on the next segment, we're going to actually talk about the sitting postures and how the sitting postures actually affect your overall spine and the nervous system as well, and what we can do, whether it's on the work front, whether you're sitting and driving, whether you're sitting and watching TV. Those are all things that we're going to talk about on the next segment. In the meantime, if you have any questions, feel free to give us a call on the number below, which is 623-334-4114. Once again, I'm Dr. Albert Kim signing off. We'll see you on the next segment. Hi, I'm Dr. Albert Kim with Signature Chiropractic in Peoria, Arizona, and you guys are listening to part 2 of the Spinal Correction Class. And again, many of you guys who are on this site are my patients, and you guys have just finished watching the importance of sleeping postures. The second 8-hour segment, we're going to talk about the typical working postures, and today we're just going to focus predominantly on the one that has to do with sitting. And it's really important that while you are sitting, that we take a look at a couple things, because when we're sitting, and I'm going to show you down here what that looks like, and many of you guys are sitting in front of a computer. We call it the rule of 90s. You want to make sure that when you're sitting in front of the computer, that the computer screen is eye level, it's in front of you, it's not 10 degrees to the left, it's not 10 degrees to the right, because even that has shown to cause abnormal stresses, not that one time, but over repetitive months and years and years. No different from carpal tunnel. That doesn't happen from one time sitting in front of the computer, but after years and years of being on the keyboard, abnormal stresses, repetitive traumas, that causes the carpal tunnel as well. So let's talk about what the rule of 90s looks like. It's the legs at 90 degrees, the arms at 90 degrees, computer screen again eye level, and the mouse right in front of you. And you want to maintain this posture. As you notice when I'm sitting here, I'm sitting all the way to the back, and that goes also for driving, sitting reading a book. It's really important to maintain this upright posture, to maintain the maximum least amount of tension that goes upon your disc, because what happens is most of us, what we find what we're doing is when we're sitting, some of us are actually sitting, an example, at the edge of the chair like this. You might have the greatest intentions, and you see by sitting upright this way, you maintain a C-shaped curve in the lower back this way. And as you look straight ahead, what happens over time is that you lose that curvature. You end up slouching, your head goes forward, and it creates this abnormal tension, allowing your muscles to strain, to cause that neck to go forward, when all this time is trying to pull it back as gravity takes over. So we want to make sure we don't allow the curvature to do this. We want to maintain this, and that's what's going to be the absolute best position and posture for you, especially to sit all the way to the back to maintain that curvature even more. When we're sitting and driving, the same thing goes. Many of us like to lean on the armrest, and if you see my spine, if it's going straight up and down this way, Imagine what's happening as you're taking that trip to California, or you're taking that trip to Mexico, or even that 30 or hour commute that many of us take to downtown Phoenix or even in Scottsdale, and we're sitting and driving this way. Or as I jokingly say, you're like my younger brother who sits all the way back this way, and imagine what that does to the spine as well as your head goes forward. So really important to sit nice and upright. I'm not looking for something exaggerated, an extension this way. It's just 10% off of neutral, and this is where we want to be driving in neutral without you leaning to the right. For us men, it's really important that you guys are leaving wallets in the rear pocket. Some of you guys have billfolds that are 2, 3, 4 inches thick, and imagine again, as you put that in your rear pocket, what that is doing to your pelvis as you shift. And you're looking at me and you're saying, Dr. Kim, my back is not improving. I'm constantly just dealing with this aches and pains. I don't know, I've been at this for a couple of weeks, and what's going on? This is why we're doing what we're doing here today, is to explain some of the things on the home front, on the work front, on the driving front of why it's so important to make sure that the things that you're doing at home, at work, everything in between is going to maximize your healing potential here, because we really want to see you guys get well and stay well. If you're sitting at home, same thing, watching TV. You don't want to be sitting at an angle where it's this way, or leaning even worse on your side, or kitty corner this way, and imagine what that does there as well to your spine. The absolute best position, you can ask my wife when I'm sitting, is usually standing in front of the TV, straight in front, looking straight ahead, and that's going to be the absolute best position as well. But that's pretty much going to cover the sitting postures overall. Again, we're here to go ahead and see you guys get well and to stay well. And if you have any other questions, feel free to give us a call at 623-334-4114. On the last part 3 of our spinal correction process, which I believe is the most important part, it's actually talking about the correction. We're going to talk about the Denneroll, and how that is a big portion of getting that spine to go from here to look like here, and we'll talk about on that next segment. So look forward to seeing you on that next segment there, and we'll see you soon. Hi, I'm Dr. Albert Kim with Signature Chiropractic here in Peoria, Arizona. And again, welcome to our YouTube site, and you're listening to part 3 of our spinal correction part of our class. And for many of you are patients, and we talked about the first 2 parts. One was about the sleeping postures, the other one was sitting postures, and those are all things that you want to be doing to lead up to the actual correction process. And the last and most important part of our spinal correction class we're going to talk about is the Denneroll. And it's not something you eat, it's not a dinner roll, but it's called the Denneroll, and this is what it looks like. It's called the Denneroll. It's by a technique called chiropractic biophysics, and the purpose of this is to create the correction in your spine. It's one of the few things that will cause that. And so instead of getting a neck that looks like this, again, that's bad. We want to get that neck and the curvature to correct that, and by laying on this, it's really important that you do a couple things. Number one, that you do some of the stretches that we will be showing you in class to start doing in the office, or actually in the home front, and to make sure you're doing that prior to doing the Denneroll. And the whole thing is to start doing it at 3 minutes and then building up to 20 minutes, and doing that on a daily basis. And so I have my TechSay, my chiropractic assistant Shauna, who is also a patient who is going to be actually laying down on the Denneroll, just showing you what it looks like to lay on it. Make sure you're doing it not in bed, because obviously the bed just absorbs the amount of tension that needs to go on the neck, and by laying on it you'll see that this neck starts to create this curvature correction, and that's exactly what we want. And the goal is to get over the 10-minute marker. For some of you, you might feel like you might get some tension, it might be difficult. Others, you might be able to lay on it like you can just sleep on it like it's a pillow. And everyone's different in how they respond, but either way, we're here for you every step of the way to make sure we get you from point A to point B and allowing that spinal correction to happen. So let me have Shauna. She's going to go ahead and lay down on our table, and she's going to show you how we're supposed to position it. And in our unit, we have a black dot, and yours doesn't have it. But there's 3 different positions. It's in the box, but the dot is supposed to be about mid-spine for her. This is exactly where it needs to be. You see this curvature that's going on to the correction, and overall you should start noticing over time that correction happening more and more, again, as we get over that 10 minutes, as we get into that 20-minute marker as well. And again, there's some other associated exercises that go along with this, but this is what's actually helping with the correction. I like to, as you can see, Shauna, if you're on your back on the floor, to bend the knees. It takes some tension for those of you who have some lower back issues. But overall, she's doing an awesome job. Again, she is a patient. She also works here as well, and she's someone that does this consistently, as well as I do, believe it or not. I still do it about 4 times a week, 20 minutes each time. And so if I'm doing it, we definitely want you to do it, because we want everyone to maximize your healing potential, allow the spinal correction to happen, and so that way you live the life that your body was designed to, was to heal and to live at its fullest. Again, this is the last part. Looks very simple, but for some of you it can be very difficult. And again, if you have any questions, we'll be here in our office. This is the part that will actually physically show you, allow you to lay down on the table and do this yourself, so that, again, you can do what you need to do on the home front to get well and to stay well. Thank you for listening to the spinal correction class. This is the last part, and we look forward to seeing you thrive and do well. If you have any questions, feel free to give us a call on the number below, 623-334-4114. See you again.